You don't need to be sick to see the doctor. You'll find many benefits having a trusted primary care provider for your healthcare journey. Eric Stanek, Chief Medical Officer of DoctorsNow, is here for today's Hello Health. And why is it so important to have a primary care provider? Because I'm guessing we don't want to just go when we're sick. We want to be preventative.
It's like the mindset of being proactive about your health rather than reactive about your health, which is probably a good approach to take to most facets of life. But getting established with a primary care provider, coming to see us over at DoctorsNow when you're well, maybe you have some issues that you want to talk about, but you're not acutely ill, you don't have the flu or anything like that. We see a lot of people through the walk-in clinic when they injure their thumb or sprain an ankle, or they get sick with the flu or COVID or something like that. But since we've been building up primary care, we like to see people when they're well, and we can do a full medical intake and see what medications you're currently taking, what your past issues have been, surgeries, allergies, stuff like that, and then take a little bit deeper dive into seeing what your day-to-day life looks like, what your work history is, what you're currently doing for work, your family life, your living situation. All of those things are really important to us, and it helps us to make informed decisions about your health.
And obviously those are benefits of seeing. Are there other benefits too, as far as getting the screenings on time, things like that?
Yeah, it all comes back to being really proactive about your health, and that's what screening is. So a lot of the screening guidelines for heart disease and different types of cancer, by definition, that means coming in when you're not having any symptoms, because these things develop very slowly, very insidiously, and people don't know they're happening. And that's why screening is so important, especially when it comes to stuff like cancer and heart disease, because by the time they get really advanced and they require more in-depth medical management, and sometimes specialists get on board too. A lot of times that's being more reactive about your health, and you want to come in and get your cancer screening and talk about vaccines and talk about heart disease and all of that stuff. And then we also do chronic disease management. That's an important part of primary care. But good, optimal chronic disease management also informs stuff like cancer and heart disease too.
Is there an issue with access to primary care? Like, is it hard for people to get that?
It's just the people that I talk to around here in the community, access is a problem. They can't get in when they need to be seen, or if they're new to the area and they need to get established, they have a hard time getting in. And so access is very important to us over at DoctorsNow, and we're happy to meet people wherever they're at in their health journey. But in terms of what they have at their disposal to be able to get into a primary care doctor, we're happy to meet them where they're at in that regard too. So we accept most major insurance plans, right? All the the Blue Cross, the United, Cigna, stuff like that. A lot of people are used to going through their insurance to get their primary care, but we've also been conditioned by a lot of these health insurance companies to think that it's a requirement to have health insurance to have a primary care doctor, and that's not the case. You can absolutely come see us if you don't have health insurance. We have some of the most affordable self-pay prices. They're fair and they're transparent, and we can see people for primary care for that. A few patients on my panel just go through standard self-pay. But then we also have direct primary care too, and that's a subscription model where it's like a gym membership or a Netflix subscription, where you just pay a flat fee directly to the practice, and we're able to see you for any of your primary care needs. All of your labs and x-rays and stuff that we do in-house are covered under that monthly fee. And we can also see you in the urgent care if you happen to get sick or you need some stitches or something like that. It's a lot of value for it, and it allows us to have affordable options for our patients and for access to be good for people. We can almost always get people within the same week, and sometimes within the same day or two.
I was going to ask, how do people get started? Because I'm guessing they probably, once they decide to do this, want to get in quickly when they're healthy.
Yeah, absolutely. Kind of bringing some of those communication barriers down so that it's not a cumbersome process for the patient. Go to doctorsnow.com. The website has all of the services that we offer, and people can get signed up and established just by going on there. If you have questions or concerns, you can always give the offices a call. We have 3 locations in the metro, and most people have told me that they have an easy time getting in and finding us, and that's one thing that they appreciate about the way we do primary care at DoctorsNow, is that it is accessible and it is affordable.
Well, thank you so much for sharing this with us today.
Yeah, thanks for having me.
And here's that website to learn more. Just go to doctorsnow.com or call 515-270-1000. You'll find their convenient locations in Altoona, Johnston, and West Des Moines, and you can see more on social media.